Hi, I'm Dr. Suraj Chiraniya, hematologist and BMT physician practicing in Mumbai. Today we will discuss what is autologous stem cell transplant, the procedure, and the post-transplant care of these patients. Autologous transplant, in short, means collection of the stem cells from the patient himself. Auto means self. In this procedure, we collect the healthy stem cell from the patients and transfuse back to him after giving certain medicine or radiation therapy. So, autologous transplant is a procedure it requires in some special blood cancers like lymphoma or myeloma. In myeloma, it is required as an upfront procedure if patient is able for transplant or after the lymphoma relapses after achieving the first remission. So, autologous stem cell transplant involves five phases. First phase is the collection of the stem cells. This collection of stem cells we do after giving some special injection. We call it as a growth factor. We usually give for 4 days, and one day night prior of the apheresis procedure, we give one more injection called as Plexafer in few select cases. Then on the fifth day of the procedure, after giving the injection, we collect these stem cells by special machine called as apheresis machine. This apheresis machine takes out a blood from the patient through a line which is usually inserted in the neck veins, and after taking this blood, it separates the stem cell of the patients and return the remaining blood back to the patients. So this all procedure is called as apheresis. Apheresis is usually is very safe procedure. Sometimes there can be minor electrolyte imbalance because of the low calcium and magnesium can happen during this procedure that can be easily corrected by giving the IV or oral supplements. Second step is, once we have collected these stem cells and we found these stem cells to be adequate in the quantity, second step is giving a conditioning regimen. Conditioning regimen means we give medicines, that is chemotherapy or radiation, to destroy the diseased bone marrow. During the same time, we create a space for the healthy stem cells to get engrafted when they are infused again. So conditioning helps in these two ways. Most of the complications like nausea, vomiting, mouth ulcers happen because of the conditioning regimen side effects. A third step is infusion of the stem cells. Usually this infusion of stem cells we do from a catheter, means central line that is inserted in the neck of the patients. Usually this is a very short phase during the transplant and the easiest part during the transplant. It involves infusion back of the collected healthy stem cell back to the patients. Sometimes in lymphoma, we cryopreserve the stem cells, or in myeloma, we give the fresh stem cells without preservation. Fourth phase is a pre-engraftment phase. Once these stem cells are given, then there is a time required that this stem cell will function to form the more healthy blood cells like hemoglobin, WBC, platelets. Usually it takes around 2 weeks. Usually WBC is the first cells to increase, followed by platelets and followed by the hemoglobin. Fifth phase is engraftment and post-engraftment phase. Engraftment phase means when platelet count become more than 20,000 for 2 consecutive days and ANC become more than 500 for 2 consecutive days. So this is the happy moment in patients with undergoing autologous stem cell transplant, that shows the stem cells are functioning and their counts, WBC and platelets, moving towards the normal. Usually in this phase, most of the symptoms patient is having because of the conditioning regimen like fever, mouth ulcer, nausea, loose diarrhea, these usually become lesser and lesser and then stop. Once patient become asymptomatic, we usually discharge the patient. The patient used to follow us initially for 2 times, once a week apart, to check for the residual symptoms if they are present or the patient develops some infection or not. We usually check during that phases. During the engraftment and pre-engraftment phase, we usually check CBC daily basis and liver and kidney function test twice a week to check their organs are affected with the drugs or not. And once they are discharged, they are followed on OPD basis. Usually at home, patient we tell them to keep them isolated for at least 1 month. During that isolation period, they should use frequent sanitizer and use surgical mask and avoid going to the crowded places. For food, all boiled cooked food they are allowed. Milk and milk product we usually ask them not to take for initial 1 month of the transplant, and raw vegetables and dry fruits which can't be boiled are asked to be avoided during that process. That's all for this procedure of autologous stem cell transplant. Please wait for our next video. Till that time, stay healthy, stay informed. Thank you.